Good morning, everybody, and welcome back to Procrastinator's Pit Stop. I am sitting here today with Dr. Julie Siemers. Dr. Julie is a distinguished healthcare leader with over 4 decades of experience in critical care, education, and executive nursing, and holds a Doctor of Nursing practice from Touro University in Nevada. Since 2009, she has empowered healthcare professionals and patients alike through her teachings on patient safety and her pivotal publication, Surviving Your Hospital Stay, which guides patients and families in navigating the complexities of the healthcare system. Julie, welcome to the show.
Thank you. Appreciate you having me as a guest.
And we're excited to have you here. We have a lot of interesting ground that we're going to cover. Before we do like to have an icebreaker on the show. And the question for you today is, which cartoon character do you resonate with the most and why?
I would probably say recently, but you know what? It's probably the theme of my life is the little Tasmanian devil. I've never accepted things at face value. And right now I see myself as a disruptor in the healthcare system because we really need a disruption about how we've always done things to really change the landscape of the healthcare crisis that we're in right now.
No, I can see that. I can like that. And yeah, we certainly do need disruptors for sure. Before we dive into the rest of this, we do like to ask you, how do you define procrastination and what does it mean to you personally?
Procrastination means putting off or delaying doing something you know that you need to do. When I've procrastinated, it has always come back to say, why did I wait so long? It wasn't that painful. It wasn't that difficult. I should have just done it instead of wasting all this mental energy kicking myself that I need to do it. I need to do it.
Mm. No, I understand that. That's I like that. I mean, you are right. I mean, 98% of the time, it's never as I guess um, uncomfortable as we think it's going to be. We all know that there's no real silver bullet or 100%, cure all that works for everybody. But what's been your secret sauce to overcome procrastination?
You know, Mel Robbins' book, The Countdown 5, 4, 3, 2, 1, when I read that, I thought that is so simple and yet so impactful. Even if it's get out of bed, put on your gym shoes, don't give yourself time to think about all the reasons why you shouldn't do it.
No, I like that. No, yeah, Mel Robbins has a lot of great books. 5, 4, 3, 2, 1. I guess the most recent one is that Let Them.
hmm
Oh yeah, definitely. Definitely like her and what she says. So going into the what you do and just the education and you mentioned before just now the healthcare crisis. Now there's a lot of procrastination when it comes to the healthcare systems in general. U.S., Canada, Europe. I think COVID really proved that to us. But when you say that, what are you seeing that we need to maybe improve?
Well, understanding that preventable medical harm or preventable medical error is the third leading cause of death is really what stoked all this in me back in 2009 when I began the research for my master's and then doctoral project. As a healthcare provider already for 30 years, I had no idea. And I thought in my research and finding that this problem has been documented in the literature clear back to 1955 in the Journal of American Medical Association when they said, we're finding the most common thing that happens to patients in the hospital is harm. And then, 25 years ago, when the Institute of Medicine put out the report To Err is Human and really highlighted how much harm is actually occurring. And I think awareness is the first piece of and recognizing what we can do to solve a problem. So that's why I wrote the book. That's why I continue the research and try to get the message out to as many people as possible.
No, and it's a good message for sure. And I know personally, I often procrastinate going to the doctor, and I would definitely procrastinate going to an emergency room or to a hospital unless I was actually dying. And I just think that that's kind of the mentality that we have now. It's not so much preventative; it's more kind of knee jerk reactionary. But when you say like how people or how families can survive your hospital stay, I mean, um, What do you normally talk about in there? What do we need to be aware of?
There's quite a bit packed into the book, but again, it's tips for people, but I'll relate it to procrastination. If we wait until we're in an emergency or we're having a health crisis, we know in that stress response, we don't learn well. We don't maybe make good decisions in that mindset of panic and fear. And I think the earlier we learn about what is our own health or disease processes going on in our body, our medications, conversations within our own family members really is going to prepare you. Unfortunately, I think we're all going to be a patient someday, or we're going to have a family member that is a patient. And if we start learning now what is normal to be expected, for example, there is a website called hospitalsafetygrade.org where you can put in your zip code and you can see whether the hospital that you normally would go to or the surrounding hospitals are rated A, B, C, D, or F. And that's on 22 categories and subcategories around patient safety. For example, the category of post-operative blood clots, they are preventable. How is this hospital doing? Are they red, yellow, or green? Post-operative breathing problems, are they red, yellow, green? Infections in the hospital. So I think that's a great place to start in being proactive, as you mentioned, and really find out what are those key indicators for the hospital that you want to go to. And maybe you'll change your mind and go to an A or B hospital versus a D or F, because your outcomes are going to be completely different. I think the statistics are 91% more chance of harm and death at a D or F rated hospital versus an A.
Well, that's a big difference for sure. And just going into that, do you think that it's, I mean, again, the Hippocratic Oath is at first do no harm, so I'm sure that we're not going out there and purposefully doing these things. But what do you think is important in terms of advocacy? Is it staffing? Is it level of staffing? Is it education and training like what you do? Is it something else that they're usually lack?
It's a combination of all of what you mentioned, Chris. Healthcare is very complex. There's a lot of moving parts and a lot of moving pieces. And it really, when errors occur, many times they can trace it back if they do a root cause analysis and see exactly where it broke down that the error was allowed to happen. Or, for example, the nurse at Vanderbilt Hospital a couple of years ago that gave the wrong medication to a patient that ended in that patient's death. When they did the systems analysis, they found the medication dispensing cabinet wasn't working right for a long time, and the nurses had to do overrides. They didn't have policies in place for monitoring patients that were getting sedatives or paralytics, paralyzing agents. So when we look at those things, then we can fix them. But pointing the finger and saying, she did it, and yes, she did, but why? And really sharing out that information. We don't have a national patient safety board in this country like we have the National Transportation Safety Board for aviation that really examine errors. For example, when the door blew off the 737 on January 5th of 2024, I think it was, they grounded all 173 of those aircraft to determine why did this happen. And then they found the mistake. And so we don't do that in healthcare, and we need to. We need to be transparent to be able to advocate, as you said.
Well, and I think that we do, I tend to think of this as a societal. I'm not going to call it problem. I'm going to call it oversight, in that we're not used to doing preventative measures for anything, really. We're used to, going along and only plugging the hole when it needs to be plugged. I mean, this is very obvious when we look at things. Well, I'm not sure about the state of the system in the US, but I know in Canada, and I know in Central America, and I know in Europe, there are many doctors and interns and nurses that work 36-hour rotating shifts, which seems kind of counterintuitive, because even the medical publications say that you're not effective after 8. And if, once you get past 12, I guess your effectiveness is essentially 0. So why they're having these shifts is beyond me. Is it shortage of trained personnel?
Yes, it is. And again, how busy it is with the expectations of what those roles in healthcare entail. But that's why I think it's so important. It's paramount for people to understand a little bit about the healthcare system, a little bit about their health, what to look for, and communicate. The Joint Commission here in the United States attributes 70% of patient harm to communication breakdowns. And that's between healthcare providers themselves or patients, family members, and the healthcare system. And I can absolutely attest to that because family members know that patient better than anybody. The nurse comes in the room, does the medications, checks the vital signs, and then they're out. But the family member at the bedside can say, hey, my mom isn't acting quite right. Something is off about her. I'm really concerned. And that really is the second set of ears and eyes that the family, even the patient themselves, can say, I just don't feel right. I've got pain, but this is a different kind of pain that I've experienced before. And those should be clues for the healthcare team to tune in and say, let me do some further investigation in this.
Is there space for that right now, though? I mean, I've heard stories. Again, I'm not, singling out any single healthcare provider. These stories are from pretty much all over. Somebody sitting in an emergency room telling their symptoms there, and the triage was incorrect, and they wound up dying waiting for care. It's almost as if there needs to be a different way of triage. Is that maybe what we could do better?
Yeah. And I think, again, that communication is so key. And my vision is that we're creating a bridge when we empower the individual and the patients and their families to really learn what questions to ask, what to watch for, that we can really partner with the healthcare team. That is probably not taught as well as it should be in healthcare professionals' education. There's a very large focus on it in the last couple of years. In fact, just this week, there's a top 10 patient safety concerns report that's put out annually. And the number one concern was healthcare providers dismissing patients and their families. So dismissing what they're saying and not really honing in and tuning in. So I think we're going to see more focus on how healthcare providers can really partner with the families and help protect patients and have better outcomes when we do work as a team.
No, I think you have a very good point there. I think that, if we're taking we're looking at everything from all angles, right? If we look at the point of view of the emergency room technicians too, that are having to do triage. I mean, again, you said it yourself. I mean, I know that, tensions can run high in emergency situations. You're in a waiting room, you're there for hours, you don't know what's going on. If you say these things to an emergency, technician, it's likely difficult for them to discern what's kind of some kind of historic, hysteria, or, it's got to be difficult for them to tell the difference between somebody who's legitimately having something go terribly wrong or somebody who's having a panic attack. I mean, that some of the symptoms and things could be pretty similar.
Yeah, one tool that I love to give patients and their families is called the 3 Ps. Be present, be polite, and be persistent. So be present means when if you're in the hospital, when the shift change between the nurses occurs, because sometimes there's an essential piece of information that may not get passed on. And you can be there to say, remember, my mom got dizzy when she got out of bed, so we need to be careful with that tonight. Or filling in the gaps can be helpful. The P of be polite, when, as you said, tensions are high, people are scared, people are fearful on the patient side, and they're busy and overwhelmed on the healthcare provider side. Using that P, polite word, can go a long way, even when we're feeling frustrated. And then the persistent is when we feel and know in our gut intuition is really important too, that something is wrong, you can escalate that concern. So be persistent in escalating to the current nurse, the charge nurse, the house supervisor. And at least in the US, we have an administrator, hospital administrator on call nights and weekends, okay, I'll come back and check later. Or if you're not getting action or intervention or being taken seriously, be persistent in escalating that up to the next person on the chain of command at the hospital. And the other tool I share is the cuss words. I talked about this in my TEDx talk that came out a month ago. It's titled How Not to Die in the Hospital. But again, when you're concerned or when you need the healthcare team's attention, using the cuss word, concerned, uncomfortable, scared, and safety situation will clue or should clue the team into, I need to take a second look or take this seriously. For example, you can say, I'm really uncomfortable with the amount of pain my mother seems to be having. This is not usual for her. I need somebody to check her. Or I'm really scared. My husband has never acted like this. This is not his usual state of mind. Something's going on. And if we can use those words to capture the attention when we need to get their attention to say, we need some help over here, can be really helpful.
And not only that, how important is it for everyone to have, I mean, now with AI and we got technology, we've got medical alert bracelets that are scannable. We've got Fitbits, we've got oral rings, we've got the insulin connectors that connect to the arms. How important do you think it is to have those tools and a list of medications and things ready in case something happens?
That is essential nowadays because reconciliation between what you take at home for medications and what you're given in the hospital, and then upon discharge, there's so many times the physician will write the order, continue meds as at home, and then they'll order also new medications or continue medications that were given in the hospital. And unfortunately, if you're not aware of what action or mechanism each of your medications do, you may be double dosed. Blood thinners, that's happened multiple times. Heart medications, you can have a beta blocker you take at home and then a calcium channel blocker that you're discharged on. And the combination of those meds can be deadly. So it's super important to understand your medications. And you brought up AI. AI, I think, is a powerful tool. I've seen very little negative about using AI. But what you can do is if you're put on a blood thinner, for example, research it using AI and say, what should I watch for as a patient? Because sometimes when you're discharged from the hospital and the nurse may go over all these things, you don't retain it. And you're like, I don't know what she said. That's why taking notes is helpful. But you can put that in AI and AI can say, when you're brushing your teeth, if you notice bleeding gums, you need to call your doctor. If you notice blood in your urine, call your doctor. If you notice that you're bruising a lot more than normal, you need to call your doctor. So those are things where you can advocate for yourself and your family members.
And are there any particular AI tools that are in existence right now that specifically help with this, or not yet?
There is perplexity.com. If you are very academic minded and you want research, you can even put in there, please provide only articles within the last 5 years that discuss your medical condition. And then you can see for yourself, what is the latest research? And that really can arm you and empower you when you go to see your doctor. They may not be up on the latest research because medical information, I think the last statistic I heard, doubles every 3 years. Even textbooks used in medical school today are behind. They don't keep up. So with AI, yeah, we have that information at our fingertips.
I wanted to touch on just the information aspect. I was interviewing a couple of other doctors, and they said that one of the challenges that they were running into is that the dissemination of approved medical practice, it can take up to 9 years for information to be amended, amalgamated. I don't know what you want to say. Has that been your experience where we've got treatments and we've got information that is not being disseminated?
Yeah, I even find it in nursing education. What we know to be evidence-based research that tells us what we're doing isn't effective and sometimes can even be harmful doesn't get to the nurse at the bedside very easily, which is why instead of a PhD in nursing, which is all research, I did the Doctor of Nursing Practice, which means I take the research and apply it at the bedside, which is where my passion is, care for the patient at the bedside. So, yes, that's absolutely true, which again is why you can actually help your healthcare providers by doing your own research. Let's just say you have congestive heart failure, or you've got, heart failure, right sided, left sided. There's different types of, just find out what, and then you can follow your symptoms too to say, hey, my ankles are getting puffy, or I'm a little more short of breath than I was, this past week. And then you can call your doctor and say, hey, I'm having these symptoms because they are relative or related and important.
No, I love the fact that we can use these tools now, but it reminds me of, and this was kind of a joke, but it makes me wonder of the responsible use of that too, because there was a joke going around that said, I Googled that my finger hurt and Google told me I was going to die. So how can we filter the amount of information? Because I mean, obviously there's some information that's going to be valid. There's other information that's going to be not so great. I mean, somewhere out there, someone says to take Tide Pods because that'll kill COVID. Um, how do we find those sources of information that are going to be a little more real?
Yeah, I had students when I was teaching Google, if I put something on a study guide for an exam and they would Google something and it was not even close to, what I taught them in class. And we would always say, don't Google. I don't know the resources that Google uses. I don't know that they're evidence based. I think you're right. They've got some wonky websites that use, you know, information that's inaccurate. But I haven't seen that with AI. And I've been using AI for almost a year now. I have found it to be very, very close to what I know or what I've learned, or that I can actually research and say, yeah, that's pretty interesting. I didn't know that, and find the evidence in the literature. Again, peer-reviewed journals and evidence-based literature is essential for making decisions about your health.
And what would you say is the biggest mistake that people make when they're trying to keep tabs on their health and their family's health?
I think not understanding closely enough and taking the doctor at their word. They may be the nicest doctor in the whole world, but they may not be as informed. I suggest getting a second opinion if it's a terminal diagnosis, if it's a serious diagnosis. And you're right, you said this earlier, that healthcare providers go into the profession because they really want to help people, not hurt them. But there also has been documented in the news and the literature about those rare cases of healthcare providers providing harm or causing harm to patients. For example, in the news a couple months ago, there was a doctor in Montana who was treating multiple patients who were in this big investigation, found to not have cancer. One man was receiving chemotherapy for 11 years and found out his bone marrow biopsy proved he didn't have cancer, but yet his physician didn't tell him. And this was the nicest doctor attributed to his patients in that area, because they would always answer their phone calls, et cetera, at all hours of the day or night, which most physicians don't do. But they found out that he was billing for those phone calls and made himself a lot of money out of the harm he was causing. Just because someone's nice doesn't mean don't do your own homework. And again, that's a rare case. Most doctors and nurses and healthcare providers are really wanting to help, but they just don't have the bandwidth to give you the time and attention that doctors did 30 or 40, 50 years ago.
Do you think um, do you think that this decline in healthcare, I'm just playing devil's advocate, do you think it could be caused by technological advances? I mean, obviously there's more people, but I mean, we've never been more distracted. I mean, in the 1950s, 90s, you didn't have cell phones pinging every 30 seconds. You didn't have, actually, no, you didn't even have pagers, right? You had maybe a PA system, but you didn't have any of that either. So is it that maybe we're divided too much in our attention, and that's why there's more of a drop as well?
I think that's definitely a part of it. It impacts all aspects of our life and everybody else's doing the same kind of activities or habits. But I also think that healthcare has changed in the regard of what's expected. Healthcare providers, you've interviewed doctors. What I've recently heard is that they only have 7 minutes per patient in an office. I don't know how you can learn about a patient's condition, what's going on, and ask appropriate questions in that amount of time. And that's why, as we talked about earlier, it's so important to bring data that you get from your Aura Ring, from your devices that give you a tracked history of what your normal heart rate is or your normal blood pressure is, and have all that ready to provide the doctor. And again, if you've got concerns about your health, try to get it to the top three, because again, the time is so short to communicate and be very clear and direct with, this is what's going on. My ankles are swelling. I've gained 5 pounds this week. I can't breathe very well. And I'm concerned about my diagnosis.
No, you're so right in that we should be prepared for that. What is the one preventative thing that, besides having the information, if you're going to the hospital, is it and you know you're going, maybe it's something routine. Is it a good idea to maybe up certain vitamins or do anything else special before you go in?
I always believe in being proactive and not reactive. So the healthier we can be, the better, really, to prevent going into the hospital if we can. So living a healthy lifestyle, starting now, not procrastinating those things you know you need to do. Go for a 10-minute walk, start small. You know, the vitamin D that we found during COVID really does help with preventing a lot of health consequences of infections, et cetera. Extra vitamin C, we've all heard that for years, but it actually is, it works. We've got evidence to that. You know, if you smoke, try to cut down on smoking, because that really does impact, especially if you're going to have surgery, going through anesthesia. Getting your weight to a good, healthy BMI really is going to help you in the long run, not only live longer, but come through health crises or health scares or health challenges, I guess I should say, better. When our bodies are tuned in and working well and eating the appropriate foods too, we all know we should do. But they really, food is medicine, as one of the functional medicine doctors I follow always say, which is true. If we give our cells the right nutrition, we're going to be a well-oiled machine and therefore stay healthy longer.
And, just going back into, doing this preventative to stay healthy and things. I mean, a lot of times it's difficult, but do you think that, also before going in, we have to monitor, things? Well, the big two I can think of would be like salt and sugar intake right before you go in, or is that not needed?
If you've got high blood pressure, you probably shouldn't be eating as much salt, and that should be some dietary advice that you get from your providers. Here's something interesting, though, Chris. 80% of medical schools don't teach any nutrition. And so that's something we really need to learn and to do on our own. We do know that Big Pharma contributes to much of the medical school curriculum. And so that's why it's kind of automatic that your doctor will get out a prescription pad and give you a prescription for high cholesterol, for example. But we know when we do some research into healthy habits, we can change a lot of that on our own by choices we make.
And, yeah, and then that goes back to, I think, what we were talking about, the information being forwarded down. I remember talking to a doctor recently, and they were saying that even though there is a lot of there's a lot of research against overconsumption of sugars, like processed sugars, high fructose corn syrup in particular, that, we should be putting warning labels on Coca-Cola, and yet we're not. Do you think that we need to be more aware of those effects? And maybe because it doesn't have a warning label, we just don't care?
Yes, absolutely. I mean, the research has found that high fructose corn syrup causes inflammation in the body. 50 years ago, at least here in the US, we didn't have chronic disease that we have now. In fact, when I'm teaching the students in the hospitals and we're taking care of patients, most of those patients have 2 or 3 or 4 chronic diseases, which most of it is lifestyle related. 95% of those chronic diseases, and a lot of that comes from inflammation inside our body. So learning those things to avoid is certainly going to be beneficial to our health.
And just swinging back to your book, just because I know I want to touch on your book as well, for our listeners, and they're already rolling their eyes because they know the question that's coming. Because I ask it to everybody. They say that actually writing a book is 98% procrastination, 2% actually doing it. How true is that for you?
Yes, it took me about 3 years. I never had intended to write a book but when I thought, how can I best help patients and their families? And it was really condensing, all my years in nursing to bite-sized pieces that people could understand. And that's why I included 30 stories in the book that related to the title of the chapters: diagnostic errors, medication errors, how to choose your hospital. But I found it took me that long because there was times where I was like uninspired and thought, I'm not sure what to write. So I just didn't write anything. And then there was times I was honed in on an idea and I wrote like crazy. So there was ebbs and flows of that process. Yeah, the procrastination part was I'm just not sure what to do. So I didn't do anything. And now I hear advice, just write something, which I should have done. I will on my next one.
That's interesting. Yes, I'm not really, I don't consider myself a writer, but I've often heard that when somebody was feeling writer's block, they would just sit there and, they'd even just pick a word, like, they would either write their name out over and over again until something else came, or they'd write, one guy said he wrote the word potato just over and over again. And I'm like, well, I mean, okay, that, I haven't tried that one, but next time I'm writing something, maybe. But let me ask you, with all the mediums available today, I mean, we've got podcasts, we've got video, we've got audio, we've got radio, we've got, courses, like you do courses as well. We've got blogs, we've got articles. What made you choose a book for your medium, for your message?
I just thought at that time that would be a way to disseminate information. When I started my business a year ago, one of my business coaches said, you really need to do TikTok and social media. I'm like, nah, I'm not a 14-year-old dancing girl. But when I understood the reach that it could have, that's when I started doing 2 or 3 minute TikTok videos. And then we slice those and put them on the other social medias, Instagram and Facebook, just so people can see sepsis, for example, a headline, sepsis kills, 350,000 patients a year. And that would hopefully inspire somebody to say, well, what's sepsis and how can I avoid it? Or what are the signs and symptoms I need to watch for? And I think that's been a great platform too. Eventually, I want to have the book made into audio because I know a lot of people just don't read as much as they used to. But yeah, it was kind of the beginning step for me.
No, I always ask because I love hearing the motivations behind the book. And it's great that you put the book out there and you're talking about, you say you're not a 14-year-old dancing girl, but they do have an AI filter for that now. So, they can put your message in there and you can have doing whatever, you can have yourself doing backflips. I've seen those now. I don't know. Do you think that that's going to take away from the information, these sort of cutesy little things that everybody's kind of doing now?
I feel like I have such a serious topic that I don't really want to make it funny, although a lot of people just tune in to social media to be entertained and to be funny. But I am finding value in the fact that I get a lot of comments that happened to me, or thank you so much for sharing. I had no idea. And that's what keeps me going, is to reach the audience that it will really make a difference too.
No, that makes a lot of sense for sure. So one of the thoughts that I had along with that as well is that edutainment, and I understand that many of us, I mean, I do this myself. I tend to deflect with humor. It's just something that happens, but I know that it's not conducive to serious topics sometimes. So do you believe that there's a space for edutainment and we should be focused on that? Or should we try to be more serious?
It's probably something I should dip my toe into because I think it, especially for really important topics like this one, I just haven't figured out quite how to do it for my piece. Although I was at the Institute for Healthcare Improvement Patient Safety Congress in San Diego on Monday and Tuesday, and the keynote speaker was really funny, although it was a serious topic. So I was thinking how I could incorporate some humor into the serious conversation. Just haven't got there yet.
I mean, everything's a process, right? I think the most important thing besides that is just to be authentic, right?
Yeah.
If we're not the funniest person in the room, why are we trying to be? If we're not the most serious person in the room, why are we trying to be, I guess? Because sometimes I know that I have this issue that if I'm coming off as dead serious, sometimes they think I'm being sarcastic, like, no, that's real. And no, really, don't eat those Tide Pods. I mean, it sounds like it. No, don't do it. This has been a great conversation, Dr. Julie. Thank you so much for being on the show. Is there anything you feel I should have asked but didn't ask, or anything that you feel we should covered?
I guess I want to close with saying, and maybe I should have opened with this, even though it's very serious situation and truly a healthcare crisis with patients dying, they estimate about 684 patients die from preventable harm every single day. And we compare it to another high-risk industry, aviation. And yes, we had that it wasn't near miss. It was a midair collision in my backyard, not too long ago, last month. And it's shocking when we hear, that happens. But the airline industry, and not to minimize these deaths, but have only had 249 people die on a commercial airline in the US in the last 20 years. So this topic really does need focus and attention and awareness. But I do have hope. I really am doing this for the purpose of informing and educating and empowering patients and their families to speak up, use those cuss words, be polite, present, and persistent, that I think we can really shift the landscape of healthcare safety.
It's such a powerful note to end on. Again, thank you so much for being on the show. Just for our listeners, what's the best place to find you, maybe connect and learn more about what you do?
All my socials and my website are drjuliesiemers.com is the website, Siemers. I've got blogs on there. I've got linked magazine articles that I've published in, other podcasts, and then just tips and tricks on the social media platforms to help you.
Excellent. Well, again, Dr. Julie, thank you so much for being on the show today. It was a real pleasure. And to all our listeners, thank you for tuning in. And just remember, if you can't find that motivation or inspiration for yourself today, maybe just go out and try to be that motivation and inspiration for someone else. And we'll see you again next time.